Tonight on Bridge City News, Prime Minister Trudeau announced today that the Canada-U.S. border closure will be extended for another 30 days. On the heels of outbreaks at 34 care centres, the province of Alberta will begin ramping up COVID-19 testing for staff and residents of long-term care facilities. And hundreds lined Lethbridge streets today to show support for the victim of a tragic accident as the family of 10-year-old Charles McIntyre laid him to rest.
Your nation, your province, your southern Alberta. From the heart of Lethbridge, it's Bridge City News with Paul Arthur.
Good evening. Thanks for joining us. This morning, Prime Minister Justin Trudeau announced the Canada-U.S. border closure will be extended for another 30 days. The original order prohibiting non-essential travel was set to expire on Tuesday.
I want to start today by confirming that Canada and the United States have agreed to extend by another 30 days the border measures that are currently in place. This is an important decision and one that will keep people on both sides of the border safe. We have the border restrictions in place where non-essential travel across the border will not be permitted. We will continue to take the measures necessary to keep Canadians safe while ensuring the continued flow of our essential supply chains on which so many Canadians depend. We made the decision a number of weeks ago to close our borders to international travelers. We recognize that this was a significant measure, but was an important one in order to prevent further spread of COVID-19 from coming in from overseas. It has contributed to why we are now in many parts of the country talking about seeing a flattening of the curve, which is good news. We included the United States in those measures because these are measures that we put in place around the world. We did take a couple more days to ensure that we were properly coordinated with our closest neighbor and most important trading partner, and that was very, very effective in it being a mutually agreed on and carefully coordinated measure. We will continue those measures both with the United States and with the world for what is undoubtedly going to be many more weeks.
The Prime Minister also announced today that the federal government will be allocating more than $306 million to help Indigenous businesses during the pandemic.
I am very happy to announce that the government will allocate more than $306 million to give Indigenous businesses the support they need. This funding will be provided through Aboriginal financial institutions and administered by the National Aboriginal Capital Corporations Association. It will allow Indigenous businesses to access short-term interest-free loans and non-repayable contributions so they are better positioned to make it through and rebound after this crisis.
Trudeau says the funding is only the first step to support these businesses. Details on further support will be provided in the days ahead. Alberta officials are tracking outbreaks at 34 care centres. There have been deaths at 7 facilities, but 21 have occurred at Calgary's Mackenziestown Continuing Care Centre. The province is also taking over operation of the Manoir du Lac Retirement Home in northern Alberta, where there have been 5 deaths. Health officials say safety protocols were not followed. Premier Kenney announced yesterday that testing at all long-term care centres will be ramped up.
So we are announcing today that in the coming days, we'll be testing all residents and staff in continuing care facilities that are experiencing outbreaks, whether those people have symptoms or not. So a further increase in the testing protocols for continuing care facilities because of their particular vulnerability and our ability to do so with our expanded testing capacity.
We now know people who may be infected with COVID-19 can potentially spread the illness before they show symptoms. Testing more residents and staff in continuing care facilities will help us prevent further infections and deaths. We have 34 sites, continuing care sites, where there's been at least one confirmed case of COVID. And as I mentioned earlier, we will be putting that list up on our website next week. One particular situation I wish to inform you about today is the outbreak at the Manoir du Lac Continuing Care Facility. Earlier today, Alberta Health Services issued a news release indicating that they will be taking over administration of this facility after public health determined that protocols for keeping residents safe and well cared for were not being followed. The health and safety of residents in our seniors' care facilities is of utmost importance, and these measures are being taken to ensure that residents get the care they need.
BC Provincial Health Officer Dr. Bonnie Henry and Health Minister Adrian Dix presented health modelling data showing declines in COVID-19 cases since the province imposed measures that restricted the size of gatherings, closed schools and restaurants, and called for physical distancing and self-isolation if sick or returning from travel. But Henry and Dix say even though restrictions could soon be lifted, life in BC will not return to the way it was last year.
Our actual case rate and our actual ICU admission and hospital admissions have been below what was potential based on the experience of other jurisdictions around the world. We are experiencing a slowing of our rate of new infections, and we want that to continue. We need that to continue for us to be able to move to the next stage. Our goal as we move forward is to control the transmission and growth of any new cases of COVID-19 in our community and minimizing any of the negative unintended consequences of these public health measures that we put in place.
There are, of course, extreme approaches as to what to do. To continue to be in these restrictions for months and months and months and months, with the consequences positive, perhaps, but also negative that come from them. Or others who might suggest that we should simply lift restrictions. And we saw in the graph and the modeling that Dr. Henry presented what the consequences of that would be. We can't go back to last December right now. So together what we have to do is we have to use our strengths to find a middle road between those kinds of extremes.
Emergency room visits are dropping across Canada as people put off going to the hospital amid the COVID-19 pandemic. The Canadian Federation of Emergency Physicians says this could be the hidden cost of COVID-19, noting heart attacks, strokes, and other ailments are still happening, and not seeing a doctor for those issues could prove deadly. U.S. Vice President Mike Pence defended the administration's current coronavirus testing plan, saying the U.S. has the capacity to do a sufficient amount of testing for states to move into phase one of reopening the American economy.
We believe today that we have the capacity in the United States to do a sufficient amount of testing for states to move into phase one at the time and manner that they deem to be appropriate.
No doubt that early on we had a problem. I have publicly said that we had a problem early on. And there are a lot of things that I think we've learned and that we are correcting and going to correct. Namely, you have a situation where tests are needed and appropriate, and either people have found there's no tests, or there's no reagents, or there's no swabs, or a person needed a test and were told that there was a restriction. They couldn't get a test. These are all the things that I'm telling you, you already know because you've heard them. So right now, or there's a delay of 5 to 7 days. And what does that mean if you want to get somebody out of circulation? We understand that that existed, but upon careful examination, what you are going to hear, that many of those have been already corrected and other of those will be corrected. For what we need in the first phase, if these things are done correctly, what I believe they can, we will have and there will be enough tests to allow us to take this country safely through phase one.
President Trump has said some states could open at the end of April and has promised governors they would be overseeing the process themselves. There has been mixed reaction to the plans. A family funeral was held today for Charles Douglas McIntyre, the 10-year-old boy who was tragically killed last Monday after being hit by a car on the west side of Lethbridge. The boy's aunt, Cara Dyer, says the family has received an incredible outpouring of support even during this COVID-19 time. While maintaining social distancing, hundreds of community members lined the streets on Coalbanks Gate and Keystone Terrace this afternoon to show their support for the grieving family. A new study shows that Lethbridge remains one of the most affordable cities in Canada for home rentals. The study, done by Rentals.ca and Bullpen Research and Consulting, ranked Lethbridge as 24th out of 30 communities in March. The average cost for a one-bedroom unit in Lethbridge was $964 per month, which is up by 11.7% from last year. A two-bedroom unit averaged $1,082. And no surprise, Toronto is once again the most expensive city in the country to rent a home. A one-bedroom unit listed for $2,213 per month, while a two-bedroom will set you back almost $2,900. Recapping one of our top news stories, Prime Minister Trudeau announced today that the Canada-U.S. border closure to all non-essential travel will be extended for another 30 days. And a look at weekend weather. It was cool today, but it looks like some mild temperatures are on the way for us through most of the week ahead. Skies should clear up tonight with a low of -3, and for tomorrow, sunshine and a high of 15. The nation of China has been in a trade war with both Canada and the U.S., and most experts in the field acknowledge that something needs to change. How should a smaller nation like Canada respond? Fergus Hodgson, Director of Econ Americas, joins us next to discuss this. That is straight ahead.